LPN do or the LVN do, and what does the nursing assistant do. Also, room assignments and priority of care is really, really important. The student can expect to see several different kinds of questions. Of course, the multiple choice questions that they're very accustomed to. Also, alternative items. This is things like check all that apply or place in sequence. The student is really often scared of that, and I know that the audience listening to us, when I say check all that apply or place in sequence, they get really nervous about those because if they miss one part of the question, they miss the entire question. So that's really a higher difficulty question. Fill in the blanks and then identify a hot spot. And also the newest thing is to put on earphones and listen to sounds or view a video or a graph. Now, we at Pearson, working with our editor, Betsy Brown, have come up with some of those that are, I believe, going to be put on the website so the student can actually practice some of those. Nursing process is divided also on the NCLEX, and then, as I said, the integrated process is client caring for your client, and then there are others that are involved there. There's a minimum number of questions, which is 75. The maximum number of questions is 265. But the candidate needs to realize that as many people pass at 75 as fail at 75, and as many people pass at 265 as fail at 265. So they need to take each question as if that's going to be the one that's going to turn the computer off or end their test. The maximum amount of time is 6 hours on the NCLEX-RN. There are optional breaks that they can take, and I really, really advocate that they take those breaks. And then there are so many things that the student can find on the website on NCSBN.org. And also listed on the left-hand side of that homepage is frequently asked questions. So the student may have many questions that they want answered, just things that are very, very simple, like what do I need to take in order to be identified at the site? What if I'm an international testing nurse? There are different things for that population that they need to know. For example, the only identification that is accepted is a passport internationally, but that's not true of the candidate that's writing in the States. So they need to really, really think about those things. And like I said, information can be obtained from the National Council. The things like cost, the cost is $200 for the National Council fee, and it varies from state to state as far as the cost, for the rest of it. So there are many, many things that they need to know about. I think that's kind of an overview. Tim, do you have any other questions that come up in your mind about the NCLEX exam? I know you're not a nurse.
My own field is information technology, and most of those exams are given in a computer-based format. It used to be several years ago that certain vendors did use adaptive testing, but now that's pretty rare in information technology. One question that does come up to mind based on what you just said is, can candidates just test at their convenience?
They can test at their convenience. Once they make application to the National Council and to the state where they wish to be licensed, they are authorized or given an authorization to test. And then they basically make their appointment in the location and the time that they choose, depending on availability. Then they go into the center, they go into the Pearson View Centers, and they present their identification and their authorization to test, and they are ushered to a computer terminal, which is, very private. They are allowed or given, not allowed, but they are given earplugs if they choose to have it, and they start their test. Now, there is a tutorial at the beginning of the test, and they need to go through that. Of course, they will go through that at the beginning of the test. So the answer to your question, Tim, is yes, they can make their appointment at their desired time. If they are unsuccessful, then they can rewrite in 45 days. But, of course, we want all of our candidates to be successful on the first attempt. I mean, that's the goal of the books, and that's the goal of NCLEX reviewing. So, yes, they can take it at their time of their choice. I tell you one thing I do advocate to people also is that an earlier morning time is usually better for most candidates, because if you sit there for 6 hours, you're going to get really tired. And if I don't go in to take my test or begin it until 2 o'clock in the afternoon, you see I could be really late getting out. So I think that's kind of important for the student to know.
Before we drill into your books, one more question about the NCLEX-RN. I mean, that's a potentially very grueling exam, grueling experience. Once the candidate completes the exam successfully, is she or he certified for life, or is there a renewal process, a relicensure process?
At this point, I guess we need to clarify that nurses, when they sit for the licensure exam, are licensed. They're not certified.
Okay, thank you.
And, but now I'm going to speak to certification of nurses later on, but they take the National Council exam, and they finish. Once they successfully pass that, then they are licensed. And
okay.
No, they do not have to take the NCLEX again. For instance, Clara, Wilda, and myself took it a very long time ago. Mm-hmm. We've never had to repeat that process. When you talk about certification, nurses in expanded roles, for instance, the nurse practitioner, or in the educational realm, we have something called certified nurse educators. Those individuals do take a certification exam. And generally with that, there is a required mandatory practice within the area in which they're certified. And there's also a required mandatory number of continuing education units that the individual has to take in order to remain certified. But there is a difference in nursing, and this may seem kind of strange in that your license certification comes later.
Yeah, that is interesting. It's a different paradigm from where I come from in information technology, for instance.
Right.
Now, my next question for the panel is this. Please tell us how your recently published NCLEX-RN exam prep book can help RN candidates to pass their exam.
Okay, well, first of all, let me say that when we prepared the book, each of us chose areas where we had our greatest expertise, and that was the area that we wrote. And also the areas of the book were reviewed by reviewers, other educators, and people in practice who spoke to those areas. So I feel like it's a really well-developed book. But the areas in the book, if you've looked at it, are specific to the areas tested by the NCLEX. For instance, the largest section of the book deals with people who have medical surgical conditions. Then there's also a section that is the maternal newborn section, pediatric, and then also psychiatric mental health care. With the maternal OB section, maternal newborn, you'll notice if you're looking at the book that there is a great devotion to the normal maternal client, the normal newborn client. But there's also a section in there that speaks to the high-risk OB client and the high-risk newborns. When you get to the pediatric section, you'll see that it begins by talking about normal growth and development in children, and then it's divided into congenital anomalies or birth problems that the newborn might have, and then it goes into other conditions that may be encountered in the pediatric setting. And then the psychiatric mental health nursing starts out with some normal kinds of things, but then goes into the pathological conditions that you see in psychiatric nursing. Each area contains not only the nursing skills, the diagnostic tests, pharmacology, and nutrition that all relate to that area. And each area, like I said, is written by someone with expertise in that area. Kind of in closing this, you'll notice also, if you're looking at the book, that there are sections on management and delegation, and throughout each of these sections that I've mentioned that are tested on the NCLEX, there are alerts and special helpful hints to the student that should help them as they get ready and prepare for that NCLEX exam.
Now, how can the self-study student marry or integrate what he or she picks up in the textbook, theoretical information, with the practical questions that are contained in the bundled CD-ROM?
Remember, we said that the test measures the student's ability to apply and analyze information. The student has to have a knowledge of the material. I mean, there's just no way around knowing the information. So in the text, we've given them the information that they need. I always tell students that they need several things in order to be able to pass the NCLEX. They need knowledge of the content. They need the ability to critically think. And as we said, the majority of the questions on NCLEX are at the application and analysis level if they're above the pass point. So whenever we give them the knowledge in the text, on the CD, we give them the opportunity to apply that knowledge to a testing situation. Then the student will learn to critically think